Attention Deficit Hyperactivity Disorder, commonly known as ADHD, is a neurodevelopment disorder characterized by inattention, impulsivity, and hyperactivity. So why are a growing number of adults in Korea being diagnosed with it? Is it inherited or developed? And what are the treatment options available? Welcome to Issues and Insiders. Today we address a rather worrying phenomenon among adults here in South Korea. For more, I have Professor Choi Kee-Hong from Korea University live on the line. Professor Choi, it's good to have you with us.
Hello, thank you very much for having me.
I also have Professor Paul Kim at Seattle Pacific University live on the line. That is as well. Professor Kim, it's a pleasure to have you with us.
Thank you. Thank you for having me.
Right, Professor Kim, we'll start with you then. Let's begin with an explanation of the neurodiverse condition known as ADHD then.
Yes, ADHD is typically diagnosed during childhood, and it includes three categories of features or symptoms. The first category is lack of attention. It can look like difficulty concentrating, making careless errors at work, easily forgetting details and not paying attention to instructions. The second category of features is hyperactivity, and it can look like not being able to sit still or fidgeting quite a bit. And then the third category of features or symptoms would be impulsivity, and that can look like behaviors like blurting out words at untimely moments, difficulty waiting in line, and sometimes even risky behaviors like doing something that's unsafe, such as driving too fast. Now, let me be also quick to point out that many of these tendencies at some point in our lives can be part of our normal development, but ADHD is talking about persistent manifestation of these symptoms and also significant impairment in social, occupational, and educational settings.
Right. And now, Professor Choi, apparently there is an alarming surge in the number of ADHD adults here in Korea in recent years. Could you tell us a bit more about this reality?
Yeah, I also noticed that the major media focused that kind of surge. But actually, it is not surprising here in Korea. About 3% to 8% of adult populations are known to have an ADHD diagnosis worldwide. However, before 2016, less than 1% of Korean adults were diagnosed with an ADHD in adults. Because adult ADHD was not covered by the health insurance at the time. So in 2016, in South Korea, national health insurance started covering pharmacotherapy for the adults with ADHD, just like children with an ADHD. And thus, before 2016, less than 5,000 cases were diagnosed as an ADHD in adults. But with the medical insurance coverage since 2016, prevalence rates of adult ADHD have been sharply increasing. So the current prevalence rates are about 5%, which is similar to other countries, and actually 5 times higher than 6 years ago in South Korea.
Professor Choi, could we assume then that the rise in the number of adult patients here in South Korea is simply because of more testing then? Or is there another explanation behind this rather disturbing surge, if I may?
Yeah, I would say the greater awareness of the symptoms of ADHD by the medical doctor and also parents and the adult populations. So that would play some role.
I see. Meanwhile, Professor Kim, for the sake of comparison, what can you tell us about the prevalence of ADHD over in the US? Is it on the rise as well? And if so, what do you believe is behind it?
It is on the rise in the US as well, and perhaps not as drastically as what you have described in Korea, but it is on the rise. And there was a study published in 2019 that looked at ADHD diagnosis in adults between the years 2007 and 2016, and found that during that period, the adult ADHD diagnosis more than doubled. And there's therefore an increasing amount of attention paid to adult ADHD in the US as well. One possible reason for this, and Dr. Choi talked about this as well, is perhaps more societal awareness of ADHD and perhaps more willingness to then get tested could contribute to the increase in terms of the number of adult ADHD diagnosis. Relatedly, as I alluded to earlier, ADHD tends to be diagnosed, or at least the onset of symptoms tend to happen in childhood. And so for adults who get diagnosed with ADHD for the first time, one possibility is that maybe they experience the symptoms throughout their lifetime, but adulthood is when they are first diagnosed. And so in a sense, it's a naming of something that they have been experiencing their entire lifetime.
I see. And staying with that then, Professor Choi, what are some of the common symptoms of ADHD in adults, and do they differ from those in children?
Yeah, as explained by Dr. Kim, ADHD is featured by three major symptom components in common, which includes inattention, hyperactivity, and impulsivity. So one of the biggest differences between ADHD adults and child ADHD involves hyperactivity. That is, adults and children may experience hyperactivity differently. Children tend to squirm in their seats and get up when they shouldn't. They may feel the need to run around and climb when they shouldn't. When children play, they may not be able to do so quietly. But adults may feel similar hyperactive impulses that they express differently. They may feel more internal restlessness. It may be difficult to sit through long meetings, meals, or even leisure activities like movies. They may avoid activities and situations where patience is required. In conversations, adults with ADHD may finish other people's sentences, interrupt, and talk excessively. And adults may take jobs that change often and highly active. They may also be prone to reckless behavior, including fast driving and substance misuse. So adults and children may have different ways of expressing and experiencing hyperactivity and impulsivity.
I see. And Professor Kim, some pundits claim that ADHD and autism share similar symptoms. That being said, how do you tell the difference?
There are at least three ways that can differentiate between ADHD and autism. One way is that for autism, or for those with autism, they might actually have a very narrow interest in a particular topic and be able to talk about that interest for a lengthy amount of time. In contrast, for those with ADHD, that type of focus on one particular topic might be difficult. The second way to tell might be for both ADHD and people with, or for people with ADHD and people with autism, there is interpersonal difficulty that's experienced, but what causes or what triggers the interpersonal difficulty might be different. So for example, for those with autism, the rigidity and the inflexibility might lead to some interpersonal challenges, whereas for those with ADHD, the impulsivity might be a trigger for interpersonal challenges. And then lastly, another way to tell the difference might be for those with autism, there's quite a bit of communication deficit when it comes to, for example, communicating feelings and communicating thoughts, mirroring the other person's emotions, those kinds of things. But for people with ADHD, the deficit might be more, as Dr. Choi also noted, the tendency to interrupt other people, the tendency to talk too long in a way that overrides the other person in the conversation. So those are some of the ways that one could tell the difference between ADHD and autism.
I see. And staying with symptoms, but moving ahead, Professor Choi, is there a connection between hoarding and ADHD? It was an article I came across as I was preparing the questions.
Yeah, ADHD has a frequent co-occurrence with hoarding disorder. There is a substantial evidence for an association between ADHD and hoarding disorder. For example, in an assessment of comorbidity in adults with hoarding disorder, about 30% were found to have comorbid inattentive ADHD, while 14% have had hyperactive ADHD. Although common etiology underlying ADHD and hoarding is still unclear, several potential mechanisms and factors have been suggested and considered. First one was the genetic vulnerability, and second one is executive functioning difficulties, which includes inhibition and difficulties in planning and spatial working memory, etc. And third is neural vulnerability, which is related to underactivation of the anterior cingulate cortex, dysfunctional activation of the prefrontal cortices.
I see. And Professor Choi, what about depression and ADHD? Is there a connection there?
Yes, depressive disorder and ADHD also frequently co-occur, which often leads to urgent situations such as suicidal behavior or significant long-term impairment such as chronic hospitalization or conversion from unipolar depression to bipolar disorders. Individuals with ADHD are 5 to 6 times more likely to develop major depressive disorder than those without ADHD. And the co-occurrence of these disorders is association with substantial morbidity and challenges regarding treatment. Because ADHD typically begins several years before the first unipolar depressive episode, earlier identification and treatment of ADHD should lower the risk of major depressive disorder.
Right, I see. Professor Kim, simply speaking, is ADHD inherited or is it developed in the course of time?
In psychology, we often talk about the nature-nurture debate, and we talk about how there are certain that we are predisposed to certain conditions or disorders because of our genetic makeup. But there are also environmental factors that could either suppress the expression of that genetic risk or perhaps exacerbate it, right? So to make the genetic expression even stronger. And so when it comes to ADHD, there's definitely research that suggests that the genetic risk is strong, but also that there may be environmental factors that could be protective or could be exacerbating. So researchers have looked at things like anywhere between family climate to environmental hazards to cigarette and alcohol use during pregnancy as examples of environmental factors that could interact with genetic factors. But in some, genetic influence is strong, and then environmental factors could bring out those genetic factors or suppress them.
Right, I see. Professor Kim, the universal understanding appears to be that women are underdiagnosed with ADHD. How do you explain this particular reality?
So I explain it using the classroom, the educational setting, and how the teacher might observe gender differences. And scholars have theorized that one possible reason for the gender difference, where women are underdiagnosed with ADHD, is because boys in the educational classroom might exhibit both hyperactivity, impulsivity, and inattentiveness, whereas for girls with ADHD, they might be more likely to have the inattentive manifestations, but perhaps less likely to have the impulsive and the hyperactivity categories. And therefore, teachers might actually be more inclined to pick up on the hyperactivity and the impulsivity, and perhaps less likely to notice the inattentiveness that might be impacting, for example, the girls in the classroom with ADHD. So I think the good news is that I see more and more attention brought to this gender difference, and the underdiagnosis of ADHD among women and among girls. And it's encouraging to see more women speaking up and telling their stories regarding their experiences with ADHD.
Right, raising awareness then. Moving on to treatment, Professor Choi, what are some of the options available here in South Korea?
Yeah, for children with ADHD younger than 6 years of age, parent training in behavior management is recommended as the first line treatment before medication is tried. For children 6 years of age and older, the recommendations include medication and behavior therapy together. For pharmacotherapy, stimulants are best known and most widely prescribed, and non-stimulant medications also prescribed, especially comorbid depression, anxiety, or sleep disturbances are the primary symptoms and cause major disability. And the treatment for adults can also include medication, psychotherapy, psychoeducation, or a combination of treatment options. So psychological treatment includes traditional cognitive behavior therapy, mindfulness-based CBT, cognitive behavior therapy, and dialectical behavior therapy, especially for impulsive behavior or self-harming behaviors. And recently, cognitive training, cognitive rehabilitation for executive function deficits has been recommended.
I see. Professor Choi, with regard to the use of stimulants, are there any risks of side effects?
Actually, we have a lot of, kind of stigmatized kind of concepts about using stimulants, but actually stimulant is not much additive, and also actually inhibit the other kind of additive kind of use of medication. So stimulants is safely prescribed and used for treatment of ADHD.
Right, I see. Professor Kim, in recent times, there's also been a bit of talk about the use of brown noise and its positive impact on ADHD. What can you tell us?
Yes, I've seen quite a bit on social media and even news outlets talking about the use of brown noise or sounds at low frequencies to help people sleep and also to address symptoms of ADHD. And it is something that's attractive in the sense that it's relatively low risk that folks could listen to this sound and experience better concentration and reduction of ADHD symptoms. However, I would also say that it's one of those things that people are speaking up and saying that it has worked for them, but the research has not caught up. And so as of this moment, as of this time, it's hard to say that research backs that up. However, it's, again, one of those things that could prove to be true through more empirical research. And I think it's a good lesson for all of us that what we see on social media as people talking about being effective, we need to also understand that we have to consult with our doctors, right, and professionals in terms of adapting it for ourselves.
Right, of course. And Professor Choi, you mentioned social stigma, and I was wondering, do you suppose social stigma here against neurodevelopment disorders may be perhaps hindering efforts to better assess and address ADHD in Korea?
Yeah, like other mental health conditions are frequently subject to social stigma, I would say that social stigma also play a huge role in treatment access to neurodevelopmental disorder, including ADHD. We have several major stigma related with ADHD. For example, ADHD isn't a real disorder, and ADHD can be handled with one's own efforts, or ADHD is an excuse for laziness. And it only affects boys, not as severe in girls and women. And those kind of stigma minimizes the psychological pain and difficulties that child or adult with ADHD experience, and thus hinder treatment access and underdiagnosed. Other stigma would be that bad parenting leads to ADHD, or medications for ADHD easily addicted, or people with ADHD are over-medicated, kind of things. Those stigma causes guilty feelings to the parents and a lot of anxiety, which also hinder their efforts to access treatment.
Right. And Professor Kim, speaking as a scholar looking into the situation here in South Korea, what do you propose perhaps to better tackle Korea's dilemma with regard to social stigma and, of course, the prevalence of ADHD among adults here?
ADHD has to be understood at multiple levels. So one level is at the training level, and that is that at the societal level, we need to do a better job of training our medical professionals and counseling professionals to accurately diagnose and treat effectively ADHD. But also at the public educational level is where ADHD must be addressed, that people, as we've been talking about today, should have a more accurate understanding of ADHD and also not stigmatize the illness in a way that it gets in the way of accurate diagnosis and treatment. I would also argue that organizationally, there has to be some changes as well, that companies and corporations and workplaces should be more accommodating and provide those accommodations that can be helpful to those with ADHD. And then finally, I would say that, of course, at the government level, to be able to have consistent funding for ADHD and mental health in general would be a promising endeavor.
All right, so we need to have a collective effort then.
That's right.
I see. All right, Professor Kim, thank you very much for your time and your thoughts today. And Professor Choi, thank you very much for your insights.
My pleasure. Thank you.
Thanks for having me.
Right, most welcome. Well, that brings us to the end of this edition of Issues and Insiders. We'll be back same time tomorrow with some bright news on K-music, K-movies and drama. Join us then. Thank you for now.